We've learnt a lot about the importance of reflective practice and psychologically informed environments in preventing burnout and tackling the root causes of that. Burnout in these contexts often come from trying to help and contain people who've experienced complex trauma. People in those circumstances will often act out, they will sometimes be confrontational, and they will often unconsciously deploy splitting, which involves showing different parts of their personality to different people who are trying to help them. That can be very disruptive for teams and can actually fracture teams and cause a great deal of individual distress. A lot of the work around tackling this has actually come from the housing sector, and the narrative behind that is that for many years the NHS has declined to help people who don't fit in the neat boxes of personality disorder without addictions and mental illness, severe and enduring mental illness without personality issues or addictions without other complicating factors. So people with those complexities often end up in hostels where they're being helped and supported by the least trained and qualified people locally. So in reaction to that, psychologically informed environments as a movement has risen up, and that involves bringing psychologists into those settings to work mainly through the staff so that they can understand these interactions, have plans in place to tackle that and work through them with reflective practice with that psychological support. So reflective practice, understanding of psychologically informed environments is the best way to tackle to prevent burnout, and we have strong evidence now that it does prevent burnout, and that's why we encourage, for example, pathway teams to have a regular monthly meeting in which they're supported by a psychologist to talk through some of these issues in a confidential, informal setting. So seeking support, seeking ideally reflective practice, and seeking colleagues with whom you can work to support you are the best ways of avoiding burnout. It's a core value of the Faculty for Homeless and Inclusion Health to involve experts by experience, people with a lived experience of social exclusion, in the design and the delivery of services. We should all be consulting people with a lived experience in how to deliver our services. For example, at UCLH they've developed a patient information leaflet, and as part of that process a group of local homeless people were consulted about the content of the leaflet and to give general advice about how to engage with people on the ward and how to help to support them. That can go right through to care navigators. So some of our hospital teams have people with a lived experience of homelessness who now provide or are employed to provide individual mentoring and support and housing advice for homeless people in a hospital setting. And there's lots of other examples across the UK and across the sector of involving people with lived experience in delivering services to improve outcomes for their peers. The idea of peer support is important and a vital component of effective interventions.
Involving people who've been homeless or who are homeless is so important. Every time I talk to a homeless person, I learn something new, something I've not thought of, how it happened, how could it have happened, and why we can't stop it. So each one has a valuable story to tell, not just in the sort of emotional content, which can be so moving and will move the hearts of anyone really, but also just the practical things, like perhaps they went to my hospital and got turned away, or didn't get given enough medication, or they were given medication that needed a fridge to put it in. And so we do need to listen. We do need to use their expertise, and they need to be with us side by side so that we can get this right.
Reflective practice groups are really important. So coming together, ideally once a week, but even once a month, ideally facilitated by perhaps a psychologist or a psychotherapist, somebody who has real experience in understanding things like complex trauma. I do think just debriefing at the end of the day making sure people get breaks, making sure they go home on time, really spotting when someone's having a bad day, because as I say, if you don't support them when they're having a bad day, they're not going to be able to support others. Also, valuing them is really, really important, and valuing the skills that they have. And obviously giving them time, continuing professional development is important, so giving them time to develop themselves and obviously giving them opportunities to move on as well, I think is important.
Working with the inclusion health populations is a real opportunity to re-engage with our empathy, to remember our values, to remember why we came into healthcare in the first place, what we wanted to achieve. One of the difficulties about working in very stressful, pressurized environments is that people learn to suppress that empathy because it gets in the way of efficiency. And often that efficiency is about getting this person out of my consulting room, my A&E department, my hospital ward as quickly as possible so that I can move on to the next patient. And that actually is in the long term counterproductive because you're losing that opportunity to form the trusting relationship. We often find that, particularly with the pathway approach working in hospital settings, particularly nurses that they go into this more than any of us because they want to care for people and they want to demonstrate that empathy. And the real challenge and difficulty that nurses have is that often it's really difficult to actually practically respond. So you learn not to open that can of worms, not to ask those questions, just briskly say, right, you can go now, and hope that won't be challenged. Whereas if in that hospital you've got a team like a pathway team, or you have some sort of protocol, or you have somebody that's got a bit of training and understanding about how appropriately to respond to the complexity which is presented, particularly by homeless people, then that gives you an opportunity to engage your empathy again and do what you want to do in your heart of hearts. So many people, after they've started re-engaging with these themes and issues, really enjoyed their work more and find it more rewarding and satisfying, even if it does mean that sometimes they have to stand alongside the patient and push back at the system a little and say, actually, this is a moment for empathy over efficiency.